In addition to the physical features, we also look at associated abnormalities. So we have a higher risk of gut abnormalities, obstruction in the gut, Hertzsprung disease where there is delayed stooling and there is a rectal problem. The mucous membrane or the muscle innervation is not complete. And we have associated cardiac anomalies in 30 to 40% of the children. In Down syndrome, if this heart disease is present, there is a higher chance of lung vascular disease as well, and some of them need surgery earlier than you would otherwise, so they need close monitoring. Higher chance of thyroid function concern. So in addition to the newborn screen, after 1 week or so, we do the free T4 and TSH to make sure that we are not missing hypothyroidism. And when the child grows up as well, we monitor the thyroid function annually. The blood count is done initially as well as annually in the initial years, as there is a higher chance of hematological abnormalities. There is a 1% risk of leukemia as the child grows up as well. And we need the hearing screen to be done formally and at follow-up as well. The orthopedic review is an additional factor because there is a chance of a hip dislocation in 6% of these babies, and the cervical spine subluxation risk is higher. So later when they grow up, we discourage contact sports and they may need a specific orthopedic review if there are any concerns. For the ENT, obviously, we continue to monitor them because of the shape of the airway and the relative reduction in tone. They are a little bit floppy. There is a higher chance of obstructive sleep apnea as well. And due to the same reason, the adenoid hypertrophy as well as a tonsillar enlargement may predispose them to middle ear blockage and hearing concerns. So they may need ENT review, grommet insertion as they grow up. So we have the 3-month review for the eyes, mainly to rule out an evolving cataract. This is looked at in the red reflex in the newborn period, but it's better to get a formal review with the eye doctor around 3 to 6 months. And the repeat full blood count can be done, and the hearing screen, we confirm it's normal and the baby is responding. At 6 months, again, if the eye review is not done earlier, you can do it. The same with the hearing test, you don't need to repeat it at that stage. The full blood count and thyroid function can be repeated, but in my practice, I don't repeat it at 6 months. I do it at 1 year again, as mentioned here. Early dental review is important. There is a high risk of caries, and hearing test and review for otitis media is important. And we continue to monitor the hearing, the ophthalmology review, dental review. Celiac serology, it's population specific, so the Caucasian population has a higher risk of celiac disease. Risk of diabetes after 5 years as well, so consider doing the HB